Our first series welcomes topic experts using the ISPA 8 investments to frame the conversation, showcasing Scotland's whole systems approach through a long-term health condition lens.
Hello and welcome to today's podcast, Movement in Conversations. We are on our first series, looking at Scotland's Physical Activity for Health framework and the themes within that. And today I am joined by Sandy Whitelaw and Chris Topping to talk about Scotland's active systems. We're looking at how active systems in Scotland are working to see more people being able to move, and what does that actually mean on the ground locally, as well as what is the evidence and the academia that supports these systems. So thank you both for coming along today. I've got Sandy Whitelaw, a senior lecturer in health and social policy in the School of Social and Environmental Sustainability at the University of Glasgow. Thank you for coming along, Sandy. And we've got Chris Topping. Chris, delighted to have you with us. Chris is the Health and Wellbeing Specialist, Dumfries and Galloway's Health and Social Care Partnership. Lovely to see you both. Thank you for coming along. Now, Sandy, I'd love to start with you, please, if we can. I've already admitted to our guests today that this is an area that I am least familiar with in our 8 themes for our first series. So, Sandy, could you start by talking to us about what do we mean by active systems? What does that mean in Scotland? And what's the thinking and the theory around active systems, please?
Thanks, Emma. I think if you take a step back and look at public health issues and public health topics, some people label these things as what are called wicked problems. So they're kind of complex and multifaceted and difficult to address. And I think if you're looking for the roots of where systems and ecological thinking comes from, it's really a practical way of trying to address the complexity of the issue. And I think when you think about physical activity and the things that shape activity, whether people are able to be active or not be able to be active, there are a whole range of different factors: personal factors, environmental factors, social factors, cultural factors. So I think, over the last 20 or 30 years in the public health world, people have started to recognise the depth of the issues involved. And I think in a practical sense, you need to match that depth with an approach. And so systems, and when you think about the concept of systems as being made up of different elements, I think at a very basic level, people feel that a systems-based approach matches the complexity of the problems that we're dealing with. And you can see that in a whole range of areas: mental health, obesity, child healthy weight, physical activity. So I think that's the context of where it's come from.
What's the work that you're looking at in this area then, Sandy?
Well, I mean, I'm doing 2 bits of work at the moment where I think whole systems approach is one strand of public health work amongst many that have what you might call an ecological orientation. So things like settings-based approaches, the kind of notion of a public health approach to ecological public health. So one piece of work I'm doing is trying to compare and contrast the basis of each of these conceptual theoretical areas to find out whether there's a kind of common thread that runs across these. And the second bit is based on the work we've been doing here in Dumfries and Galloway. And we were fortunate last year to run in parallel 2 whole systems approaches exercises, one related to physical activity that we'll talk about, but also one in parallel that looked at child healthy weight that was funded by the Scottish Government. So it's been a kind of unique kind of experiment of running these 2 things together and trying to kind of compare and contrast the different approaches that were taken in each of those exercises.
Cool. Well, when I was looking at what we would talk about today and sort of taking a little bit of a deep dive, and I looked at what is suggested within the framework, the Physical Activity for Health framework, and was reflecting on it, a real intersectionality and a real need for a lot of work around the data, so that the data talks to another piece of data that talks to another piece of data. And in my head, I suppose, because I'm quite a visual person, thinking about layers interconnecting, overlapping each other and working together, and all of those layers understanding their part in it and how they are impactful. Yeah. Is that, have I kind of got that right in my head?
I think that's absolutely spot on, Emma. I think it's spot on, at least at a theoretical level.
Yes.
I think I think one of the issues of the whole systems approach literature in a world is that it's quite theoretical and it's
Yes.
quite idealistic in its approach. So I think that whole thing about intersectionality, about mixing of ideas, and you see in the systems theory literature ideas of feedback loops and emergence and cross-cutting ideas. I think one of the things that maybe we can talk a bit about further down the line in terms of being critical is that some of those ideas don't necessarily fit easily within the current policy and practice landscape, and they're actually quite difficult to conceptualise to start with, because you need a level of kind of innovation and creativity to be able to do that, and you need time to do that. But I think as an ideal, that's exactly the basis that you've described.
Yeah, and thinking about going back to the social determinants of health, for example, and that diagram that we're all very familiar with, and that holistic needs approach for humans and all the different bits of impacts coming into them. So that's what's happening in my brain when I'm thinking about active systems and things. So I'm glad I'm on the right track.
What's interesting about those models, like the one you're talking about, the Dahlgren and Whitehead model, is that those areas are still discrete. They're still separate to each other. No, they don't actually articulate a more dynamic approach to systems where you say, well, how does the sociocultural environment interact with individual psychology and perception and cognition? So they're almost like, if you think about ingredients, they're still sitting there separately. But if you wanted to kind of mix them together, then in a truly systemic way, then you would probably do more than that. So I think there's a differentiation between static models and dynamic models.
Yeah. Lovely. Lots to come back to there.
Good.
Chris, do you want to come in at this point? Chris, I'd love you to tell us a little bit about what does this look like in a local level? How did we end up here in Dumfries and Galloway? Obviously, Sandy and yourself have been working together on some of this, but from your experience, what's been the process? What has that looked like for Dumfries and Galloway? And also why? I think that there's a why question there for me. Why this approach? And we can come to sort of what your findings are, what you're finding out as you go.
Thanks, Emma. And I think it's fair to say it's been a fairly long process, but I think a really worthwhile process as well. So I think our interest in systems probably predates the COVID pandemic.
Mm-hmm.
When actually we started an approach as part of the early adopters in Scotland that first looked at implementing a systems-based approach in terms of the wider public health reform agenda, so working very much with Scottish Government, Public Health Scotland and other agencies as well. And that was quite a system science-based approach, and we actually managed to deliver a workshop before COVID, and then due to the pandemic start, we had to pause that process. To answer your question, why I think physical activity levels in Dumfries and Galloway have been fairly static over a long period of time. They range potentially go up by 1 or 2% or down by 1 or 2%, so fairly static. And going back to what Sandy has already described, that actually we wanted to look at how do we tackle the root causes of inactivity. Dumfries and Galloway as well being quite a rural region as well. So actually, how do we put in place a strategy with our partners to tackle those complex problems in a systematic way and quite a practical way as well, bearing in mind even predating the pandemic, financial resources were also beginning to get tougher and have continued down that spiral. So how can we work differently, recognising that, and it's long been in the literature, there is no one silver bullet, there isn't one thing we can do, but actually how can we work different together through a systems-based approach to tackle the root causes in terms of inactivity in our region.
And what are those differences then? What have you put in place through this process? What does look different to what was before?
So I think the first thing, coming out of the pandemic gave us a chance to reset in terms of our strategic approach for physical activity in Dumfries and Galloway. We did have a multi-agency physical activity group, but I think one of the challenges that group had was that it kind of sat in isolation. There was no leadership and governance routes into community planning structures, into integrated joint boards and that decision making. So we took the opportunity to reset, and that's where I think the active systems, when it came out through the Global Action Plan, laterally through the Public Health Scotland and Scottish Government frameworks, that actually if we are going to tackle, as I've said, those root causes, we need that leadership and governance at the highest level in place. And I think the fact we had a strategy that was council focused, and actually through COVID, the relationship between the public sector, the third sector had really grown. The partnerships in physical activity, they were always there, but I think you saw that real enhancement through COVID. So there was an opportunity to bring partners together. I think in terms of that strategy, the opportunity to broaden it out, but also use the strategy as a vehicle for an output in terms of to reset the physical activity agenda. And at that time, we were really fortunate that Public Health Scotland had just published the systems-based framework, which I think gave us an opportunity and a method to actually implement a systems-based approach in quite a practical and pragmatic way. I think what I have found really beneficial about that document is that it was developed with national partners and local partners together. So what we got was a feasible approach that was quite practical. It did have system science in there, but actually it had translated it down into a series of steps that could be implemented within the capacity and time that you had those senior leaders around the table. So I think it was a bit of timing, but having a strategy and output and then the systems-based methodology to drive it, we took those approach.
Okay. So I'm instantly thinking about something that I sort of discovered in my research with this actor mapping, which I think is what you've just described in sort of who needs to be at the table and who needs to be talking to whom. And as you say, it was sort of very council born in the beginning, but actually that's kind of evolved and has seen other actors coming in to help shape and add more layers of intelligence to those conversations by their unique experiences and their unique take on what they deliver and who they talk to. So with all these people round, I'm imagining a really large table or a screen with many squares talking. What are the outputs of things like this? So I know that obviously in Dumfries and Galloway we've seen a real amazing kind of website and other things happening that local people can engage with. But what else? What comes out of these meetings? What's processed?
So I think the first thing to say is in terms of so we use the systems-based methodology to drive our strategy, which is close to publication. We're getting there. I think what's been really useful and what you've seen with the process, and hopefully partners see it when they see the final version, is that one, we brought together, and that's a really interesting point you raised more broadly about what is the boundary around the physical activity system, because it's absolutely huge. So one of the exercises we did right at the start with Public Health Scotland and other colleagues was to do some landscape mapping. Who are the key actors or the key partners that are around the table? So we did that to try and inform it, and we did put some boundaries on it, loosely speaking, but we wanted to get the main people from public, private sector around that table to inform those discussions. We had a series of multi-agency workshops. I think the first invite list was around 90 people, maybe more. We didn't get them all, but we got a huge proportion of them. And from that, they developed 500 to 600 potential actions, which was quite a high number to sift through. So they looked at things like what we were doing that was going well, what requires development that's happening, and any gaps. So we systematically used the process, and each one of those 500 to 600 actions from across the settings. So we had education, sport and active recreation, health and social care, active systems. So we had 2 reviewers, 2 experts look at each one, and we refined those down alongside the Public Health Scotland evidence briefs to about 50 to 60 high-level actions. Everyone's work was critically appraised, grouped, scaled down. We then brought them back to a second round of workshops to say and scored them, looking at both impact and feasibility, obviously looking for actions that were very feasible and high impact. They were then refined down again, and what we managed to show people was the evolution of the actions. So everything and I think we're down to about 50 now, give or take, high-level actions, which across 8 subsystems, I think, isn't too bad. So actually what we've done through this process is we've also tracked the actions. Those original post-it notes, the process, so actually people have ownership of the actions within the strategy because they know how they developed, how they evolved to what we got. And I think that has really helped bring ownership to some of the actions and make it really local, but also aligning it back to those evidence briefings and the feedback we got from the people who were involved. So quite a lengthy process.
Really interesting. A lot of plates to keep an eye on there. Andy, I wrote a word down, and it was accountability. You've got a lot of people being sort of understanding the actions and where they sit within those actions and things. How important is accountability within all of this? Is it accountability in a process, or is it accountability of actions or end results, or how does that work from your experience?
It's really interesting. If I take what you mean by accountability is that you
Sure.
you have some kind of justice for the people who are involved in the process, that their views are being heard and they can participate and contribute.
Yeah, participate and contribute, but also that the results of this work is then also sort of, it's a measurement, I guess, as well, of the success within the type of working.
Yeah, I mean, it's a difficult one, I think. I think that in terms, it's definitely a process. There's an accountability in terms of the process, that people feel that they've been part of a healthy exercise. And I think, we evaluated both of the sets of the three workshops using participant observation, survey methodology, and focus groups, and it was clear from that people were satisfied with the process. They felt that they had been listened to, and I think the whole point of systems building is this kind of contributory aspect to it, that people, it's constructed. Right. Systems are construction. The whole, this kind of differentiation between hard systems and soft systems, where soft systems are about people and people coming together and talking and communicating. And I think all the work we did post the workshops pointed towards the fact that people did feel that they were involved. So there is a level of accountability there. I'm struggling a bit more with thinking about the longer term accountability in terms of the sense of saying, do people feel that what they did in those workshops is fed into the strategy, and then that the strategy will then deliver on those. I think the other thing to say as well is I guess sometimes systems can be conflicting systems. So if people feel that there's no accountability in the sense that some people's voices are heard more than others, or that some positions are favoured over others, that can be problematic in situations. And I don't think Chris could comment, but I don't think there was I think one of the participants talked about it was kind of fair and open, but not necessarily consensual discussion that happened in those workshops. So people were disagreeing about stuff, but ultimately, I think the way that the facilitation of the workshops, the physical activity and the child healthy weight, really, really good, really expertly facilitated, and I think those feelings of kind of conflict were managed really well and accommodated. But I'm still struggling with the accountability in the long term, which is a really good question, and what it looks like.
Yeah, but maybe that's something to consider as this grows and is shared further and more learning comes. Perhaps it comes out in that piece.
It doesn't. I mean, Chris and I were talking earlier about, systems is not, it's not a cross-sectional thing, it's a longitudinal thing. So I guess accountability comes through people feeling continually involved in the evolution of what they've done. I guess in the systems approach, there's not an end point. It's a rolling ball that carries on, and you learn from feedback and from reflection, and you press on. So maybe that's where the accountability comes in terms, again, it's a process thing rather than necessarily an outcome thing.
Oh, that's really interesting. So then something else pops into my head about probably what we can talk about now in terms of some of the challenges. You've already said some conflict within systems and things which aren't necessarily challenges, maybe just things to be worked through. But I'm then thinking about sort of quite basic, maybe just logistical challenges of this type of work, and where the knowledge is held and where the sort of evidence and intelligence comes from. And just thinking about the sector that I work in within the charity organisations, and when people leave, and how do you get consistent buy-in from all the different actors that you need, consistent sort of buy-in and then reciprocity for, and that feedback cycle. How does that look practically, or is that something that is just a bit harder because it's not necessarily something within your control? I
mean, I could answer that initially, but Chris, probably more detail. I mean, my view is that Chris has developed a system that goes beyond individuals. I think that's that you make that transition from, as you say, things. And it comes out in partnership working a lot. People say, "Oh, partnership works because we all get on well together." And as I say, when people leave, then the partnership falls apart. And you do need some form of infrastructure around the partnership, around the system. And I think in D&G that has happened. Chris will be able to say, probably practically how you've been able to do.
Yeah, I think the first thing to say is we're quite lucky because we're co-terminus. So we're one local authority, one health board, and one third sector interface. So I think that's really helpful in terms of those relationships, and being quite a small region as well. People are quite well connected just by the nature. I think probably a couple of observations that there's a lot that can change and things are always fluid. We've just done a piece of work with the University of Edinburgh that's actually looked at changes in physical activity, best investment projects since 2017. And what you've found is the landscape has changed immeasurably in some areas. So you've seen big investments in the active and sustainable travel. So the range of active travel projects, policies and partnerships is very different. So the systems evolved significantly. So the active travel investment into health, into education and that cross-sector working has really, really expanded. So systems by themselves can be quite fluid just by that. I also think as well in terms of the system, in terms of our local delivery, we set up a strategy implementation group, which was representation from council, health and social care and third sector. That was there from predating the development of the systems-based approach. And I think what we've done is we created a group based on previous experiences that can go away and implement decisions. That's an interesting dynamic as well about what level do you create these working groups at, because sometimes it's within big organisations, it's the heads of service who can remobilise resource, remobilise capacity is where you can actually begin to change and influence the system. It's not always the people right at the top of organisations who can act, they can give approval, but actually in terms of mobilising and changing that system and that resource and that dynamic, they're often critical. So that was previous learning from what we've done before. I think as well, we've also seen just by nature of national policy, and again, that's come out of local feedback, that actually there's a real recognition across government and Public Health Scotland documents for that need for system-wide approaches, that collaborative working. You're seeing even the way the investment's coming down, that need to work together. So I'm thinking, for example, the National Physical Activity Pathway, we've managed to scale up with, it's a clear collaboration between council, the health and social care partnership and now third sector. So you're seeing just by nature of partnerships that we put in place that kind of system-based working is now becoming more and more organic, and people are, building that collaborative approach. One, because I think people recognise we need to, if we're going to tackle population activity, but B, I think people are seeing it now as a really effective way to deliver better outcomes for our local population as well.
Thank you, Chris. And I'm wondering then about how we evidence this, how things are measured within a system. I don't know if Sandy, is that something that you could speak to a little bit about how this, because Chris has talked about something there that has to be quite agile and move with a shifting landscape. How do we evidence and measure what goes on to see the effectiveness of this type of working?
Well, I think, again, we're back to the kind of process outcome type orientation. I'm a great believer in process, and I think if you get the process right, and I think the constructed approach to systems means that, people feeling that they're part of something is really important. And I think the evaluation we did in the workshop showed that happened. Now, the outcome bit, I guess, is the trickier bit. And we had a discussion at the group yesterday, didn't we, Chris, about, we've now got a range of strategic objectives and having the ability to be able to monitor those. And we started grappling with words like evaluation and appraisal. And so I don't think it's necessarily always boils down to kind of hard, tangible outcomes. There's something, particularly in a systemic context, is about appraisal, which is a kind of softer overview of how things are going, which I know sounds a bit woolier compared to saying, have you achieved what you wanted to achieve or not? But there is something, in my mind, in this whole systems world, that's not just about the mechanics of individual bits working.
Yeah, and I think that's where the appraisal comes into it, because it's broader. There's more depth to it.
Yeah. And Chris and I have written about this already in another publication where we say, that the kind of best investments and evidence-based thing tends to happen on an individualised basis, each individual intervention or project or approach, where in a systemic world, these things are actually contributing to each other, that they're working together. So we can't, this kind of idea of league tables and best investments and, it doesn't really work in a systemic context because it's about ingredients towards a bigger whole. So it does pose issues, I think, in terms of how we appraise things in the long term, in terms of outcome.
That's interesting. And Chris, I did wonder about then in terms of the data that needs to talk to each other in this scenario. As you've said, you've got health, council and third sector in one. I've forgotten what you called it. Sorry, your multi...
Yes.
What's it called?
We've got a multi-agency physical activity strategy oversight group, if you come together.
Sure, but how you're set up, your health board and council and third sector together, which I think must be, I'm hoping is very helpful in terms of the data talking to each other. Is that a correct assumption from myself?
Yeah, and I think it's complex. So we're collecting evaluation data at a range of levels. So the strategy has 3 high-level actions that, in theory, if we deliver all the actions in the strategy, the totality should hopefully help drive population-level decreases in population inactivity. So we've flipped it from trying to increase levels to reduce inactivity. We've now got a target around reducing those who are most inactive. And I think because we've got the multi-agency group, for the first time we've actually set a population target around muscle strengthening as well, which I know, Emma, you've got a huge interest in as well. So, but under that, we've got a range of other indicators. So, for example, health are working with travel and education to look at an annual physical activity school survey. So that looks at 2,000 to 3,000, hopefully young pupils every single year. So we've got the Scottish Health Survey for adults, but we've got our school survey for children and young people. So that gives us some surveillance that we're able to track. And then the next task will be to look at the evaluations of the actions within the strategy. But actually, I think learning from previous work is trying to, and I think Sandy said it, weigh the impact of a health walk, that's run by a volunteer against a £1 million coastal path. It's just not practical to do that. So I guess there's 2 things. One is because we stuck so rigidly to the evidence briefs from Public Health Scotland, we know that the actions within the strategy are evidence-based and if applied correctly, should then help us reduce inactivity. We will do some project level data as well. And then we'll work with Sandy and his team to look at how do we look at the overall process of the systems-based working and the leadership structures that we put in place. So I guess it's multi-component and all answers part of the overall picture.
And I really like that strategic decision to really look at addressing sedentary and the inactive to active. Movement for Health is most interested in that population in Scotland that would fall into the inactive category, most of whom will be living with one or more health conditions and supporting others as carers within one or more health conditions as well. And I think something that struck me from the Burden of Disease report and was Linda Bald spoke at our conference last year about that this is the population group that is vitally important that we target and that we make sure that when we're looking at systems approaches, communications approaches, all the different approaches, that we're looking at creating something specific for that population group, because it's that we will see the most health benefits at a population level if we're targeting at that level. So I'm really pleased to hear, was that a strategic decision? Or did that happen was everyone quite in agreement about that? That's how it will be framed moving forward for Dumfries and Galloway?
So I think there was broad agreement. I think in terms of, there was some discussion because generally it is about increasing population levels of activity. But I think, generally speaking, the move towards an activity and that alignment with the Global Action Plan, Scottish Government targets was quite welcome. I think and I think the report you mentioned I can't remember, was it Burden of Disease?
Burden of Disease report, Public Health Scotland.
So I think that was really powerful, one, because it presented at national but also local level as well. So I think that really helped shape the argument. So in terms of our health and council physical activity programmes, so those are physical activity or exercise previously referral programmes or health walk programmes, when we evaluate, do now look at, rather than saying we're going to increase the number meeting those guidelines, we're now tracking those who are most inactive, who move to limited or some, because we know that is where we'll get the biggest public health gain, but also that's where individuals get real health benefits as well. So we've built that into our standard monitoring evaluation as well. And we've also done that through our school survey as well. So we break young people's physical activity down into those categories as well. So at all stages of life, we can look at evidence and show an impact in terms of getting those least active moving a bit more.
Excellent. And I actually saw, I was reading this morning, the latest Walking and Cycling Index from Sustrans, but it was children's, specifically from a children's point of view. And it was really interesting to see that actually children as well want safer spaces, wider pavements, all very practical things, the 20-minute neighbourhood, not within those words, but that sort of thing, we want things closer to us sort of thing. So I'm just really interested that you have a school's piece of work as well with travel specifically linking in there as well. That's really interesting.
And I come back, I think you mentioned about communication as well, and I think that finding, I think, is fairly common, that in terms of, we want safer environments, cleaner environments for our population, not just children, young people. I think there's a real message to get those messages out to the public in terms of, investment into active and green infrastructure. Being a rural region, there's a lot of energy and focus on roads, which are obviously critical in a rural region, but actually there's how do we, develop evidence-based messaging or communications campaign to put those type of arguments at the front and foremost, both in terms of policy and also our communities as well.
Absolutely. I actually think that children get it right most of the time. And I think that children are very interested in our environment, and we're very good at younger ages talking about the importance of planet and its relation to people as well now. But it seems as we get older, we shift that emphasis and importance onto other things. And then as adults, sadly, for many, it takes the priority. So I'd love to see more children being able to have their voices heard in many, many discussions. Sandy, I just wanted to pick up with yourself around any challenges that you've come across in your role with working with Chris, working around active systems. Just thinking about anyone listening to this podcast that might want to replicate some of the work that Chris and co are doing within Dumfries and Galloway area. Is there anything that we can help them in terms of identifying with your learning already that might be trickier to explore?
Yeah, I mean, we're writing up this work at the moment for a journal paper, and we've got 3 themes running through it. I mean, I think one, and this sounds a bit contradictory, because I think one of the critiques of systems work is it's too theoretical. I think the early adopters work, I was looking at that report just the other day there, said that, some of the work was far too systems theory driven, and people find it complex and long-winded. But I think, having said that, I think having a clear idea of the kind of systems theory that you're drawn upon is actually quite useful. The old saying, there's nothing more practical than good theory. And I think one of the critiques of the practical whole systems world is that there's the visibility of what type of systems theory are people drawn upon, because there's a whole range of different ways that you can conceptualise theory. From, I said earlier about, the classic differentiation between hard, soft and critical systems. So I think just being kind of conscious of what kind of assumptions are you making about what you think a systems approach is? And I think you talked about it right at the beginning about, this kind of interactivity is clearly important. But I think for some people, it's probably maybe not. Maybe that's not at the foreground. But so I think reflecting on the kind of general area we're working is really important. I think the second area is being conscious about the types of outcome that you expect. And it was interesting just watching the process of the workshops, like the huge range of outcomes that people were expecting and the different types of things that people were talking about. And there's some of them things that are already happening, some things that are not happening and should be happening. So I think just being conscious of what we're trying to get, what the purpose of the workshops was really important. And I think the third thing is about engagement with what's already happening, being very conscious of the nature of the environment into which whole systems intelligence or outcomes actually feeds in. And I think for me for us I think it's been the big lesson of this tension between what you might call an idealistic whole systems approach, which is like takes on the whole thing, and I think the term that Flora has been using is a systems informed approach, which is a much more grounded incremental approach to things, to say, well, what can we do here that will actually be listened to or fed into pragmatically into what's already happening. And I think, as I said, the policy world tends to be conservative. It tends to develop very, very slowly. So big ideas, new ideas tend not to be favoured that much. And I think what came up in the workshops was the financial context as well, in terms of, there's not a huge amount of resource to do this stuff. So I think that kind of having a having an awareness of what you want to do with this stuff and where it's going to go, and maybe preparing the ground before you do the systems work to understand what those mechanisms are. So the actor network becomes not just the people involved in the workshops, but the wider network of people who are actually going to make these decisions ultimately. So those are the kind of three areas that I think are important.
That's really, really interesting, three areas for people to potentially look at. Chris, do you have anything to add in terms of from your sort of hands-on, local, practical approaches with systems working? Is there anything else that you think people need to really consider at the beginning, or even if they're already they've already committed to working in this way? I'm also thinking that potentially people are already working in this way without necessarily realising it either. I think many sectors have often had to work in this way because of the nature of the work that they do. And this is just another way of framing it and understanding it. So Chris, but is there anything more specific to physical activity and specifically within inactive populations that you've noticed that could be helpful to anyone thinking about working in this way?
I think that's a really important point you just raised, that a lot of this, there are system-specific elements, but there are elements that are just good partnership working and good relationship building. I think as well, and a couple of things to acknowledge. One, I think Public Health Scotland have published essentially a route map, a step-by-step guide. So that is a really useful reference for anybody who's starting out this process. Myself and Sandy were in a meeting with our leadership group yesterday, and obviously we've also had benefit of expertise from Public Health Scotland and Sport Scotland as well. So there is support available. I think just to reassure people. I think for me, I think what's been really helpful for us is to really, before we embarked on this process, is to have, one, it was having an output at the end of it to bring people together behind. So we had that strategy. That was the purpose of the process, and people wanted to get behind the strategy. Being clear about what your vision for the strategy is, which obviously others can shape. And also, I think we mentioned earlier, doing that landscape mapping and knowing your system boundaries. So creating the conditions in terms of knowing your system, knowing your partners within it, and then bringing people together with a common purpose. I do also think what was really key for us was to have that multi-agency and oversight group with all the subsystems there. All those key subsystems that shape our systems had a voice from the start. So identifying who those people are and actually making sure and working with them to understand what the capacity is. Because it is, at times, it can be quite, although pragmatic, can be quite a lengthy process. So having a group there with the time, the capacity and the commitment to then go on and enable the change and take you through that journey, to me would be the key things. And essentially knowing who your inactive groups are in your community and what you're already doing and building from that, I think is really helpful. So that landscape mapping right from the start, I would say, was pretty key for us.
Yeah, it doesn't sound like anyone would need to start from scratch with anything like that. It feels like there are many pieces of this puzzle already happening, and it's a way of bringing all of that together and looking at it in the round. Something that I've taken away is it's also felt like it's a continuous learning and continuous reflections, and that shapes the next bit, and that shapes the next bit of understanding. And as you say, it's never finished. This is a process. It's a way of working. It's a way of being. Thank you both so much for joining me today, discussing Scotland's active systems within the Physical Activity for Health framework. Really appreciate it, both Sandy and Chris. Thank you so much.
Pleasure.
And thank you. And thank you for listening to today's Movement in Conversations. We've hoped you've enjoyed it. And if you have, please check in with the other episodes in this series, all about helping more people to move more in Scotland. Thank you and bye-bye.